Hello and namaskar. Today we'll talk about the scope of treatment or prognosis for a very common disease called PCOS or PCOD, which is a polycystic ovarian disease. Very commonly seen from the age group of say around 15 years to 40 years. Approximately 10 to 12% of the world population and up to 20% of the Indian population, females suffer with this condition. We'll talk about the prognosis using homeopathic medicines. My name is Dr. Rajesh Shah. I'm a medically trained homeopath and director of Life Force, where we treat patients of all kinds of diseases from across the world. This small observation, what I'm going to share, is based on our experience in the treatment of documented cases of over 500 cases of PCOD at Life Force. PCOD is a complex disease. It is a disease which is triggered by hormonal and genetic factors, and at different ages in life it may present with different symptoms. For example, a young girl of around say 15 to 18 years may present with some very superficial symptoms of PCOD, which could be just hair loss or putting on weight or acne or hirsutism, that is excessive hair growth. And this is because of the hormonal imbalance as well as androgen or testosterone hyperactivity. In the later age, one may experience irregular menses, painful menses, prolonged menses, heavy bleeding as present symptoms besides acne or hair loss and putting on weight, fluid retention. In the later age group of around say 25 to 35, many females may present with infertility as a presenting symptoms, and the PCOD could be the etiology, it could be the cause in the background. Every case of PCOD requires thorough investigations by sonography, by hormonal assays, etc. One of the presentations of PCOS is abnormal weight gain. Homeopathy cannot help you to directly reduce the weight. Weight gain requires strict dietary changes as well as lifestyle changes, exercise and gymming. And without that, only with homeopathic medicine one cannot expect to reduce the weight. Of course, thyroid dysfunction is one of the common factors responsible for weight gain in the cases of PCOD, which requires a separate attention with the medicine or with supplements. So depending on the presentation at a given time, the treatment and the prognosis would differ. All in all, homeopathic medicines can help some of the cases of PCOS or PCOD in controlling the symptoms, in regularizing the menstrual cycles. In case of heavy bleeding, homeopathic medicines can help to reduce the bleeding, the flow and the duration in case the bleeding is lasting for a few days or consistent bleeding for many days. Homeopathy can also help to reduce the painfulness of the menses. Homeopathy can also help to reduce the hair loss, fluid retention, acne. Homeopathy cannot reverse the excessive hair growth, what is called as hirsutism. Homeopathy can reduce the size of the cyst in the ovaries to a certain extent. However, we cannot say that certain medicines could specifically immediately eliminate or reduce the ovarian cysts. It's a slow process. It is governed by various hormones, as I said, and fundamentally the objective is to regularize the hormonal imbalance in the body, and thereby one will see the results. All the cases of PCOD cannot be cured or cannot be improved significantly with homeopathy or with any system of medicine for that matter. But the results by and large are reasonably good, and the homeopathic medicines are safe to use for the cases of PCOS or PCOD. If the cyst is extremely large and resistant to treatment, one may require some surgical intervention as well. Homeopathy is of course strongly recommended, as I mentioned, for most of the symptomatic relief and improvement in the cases of PCOD. The duration of treatment again varies from patient to patient, and it may be from 8 months, 10 months to maybe a couple of years. So I hope this video will help the patients of PCOS or PCOD as well as the practitioners and the students. Thank you very much.